Hi, Mr. Baker. My name is Savannah, and I'm a nursing student that will be helping to take care of you today. Today, I want to go over some discharge teaching with you so that we can keep you healthy when you leave the hospital. Specifically, I'll be talking to you about preventing infection. First, I just wanted to go over your diagnosis with you to make sure that you understand what is making it hard for you to breathe. I know that you have been diagnosed with COPD for the past 6 years, but I just wanted to double check and make sure that I could answer any questions that you may have. So, as we know, you've been diagnosed with chronic obstructive pulmonary disease, which is typically caused by long term and excessive smoking. What happens is that the airways get inflamed, and this makes it harder for you to get air in and out of your lungs. This is why you often feel short of breath. I know we've talked a bit about your anxiety while you've been here, and that a lot of that revolves around caring for your wife. My hope is that the home health nurse and social worker will be able to give you some assistance in this area as needed by connecting you with respite care. I know that we talked about the financial aspect of staying in the hospital, and I think meeting with the social worker could really help. They can teach you about insurance, such as Medicare, and how you get to benefit from these systems. This will hopefully take some strain off of you. Additionally, I want to remind you about the pursed lip breathing that we discussed to help you when you're feeling short of breath. Remember what we talked about, that you breathe in through your nose and out through your mouth, and the breath out should be twice as long. And when you breathe out, it should be like you're blowing out a candle. This will hopefully help with calming you down when you're feeling anxious and helping you to catch your breath. Once you go home, you will have oxygen just like you did in the hospital through a nasal cannula, and you can use it as needed at nighttime. So you don't have to use it, but if you feel like you need to, you definitely should. I want you to follow your medication prescriptions and call the doctor if you have any questions about them. Again, I really want to encourage you to follow through with your social worker and home health nurse meetings. They're really great, and I think they could really help you. By the end of our time together, I want you to be able to teach back to me the things that I'm about to tell you about preventing infection, and be able to explain to me why you specifically are at a greater risk for infection. As an older adult, you are at a greater risk for infection because your immune system is not as strong as it used to be. COPD also puts you at a higher risk for infections like pneumonia. These are respiratory infections, so they exist in your airways, like your lungs and the tracts that get the air to your lungs. Any infection can make your COPD symptoms worse, and so it's very important that you follow these steps to avoid getting an infection. Even something as simple as the flu could make your symptoms a lot harder to deal with. The first thing I want to talk about is washing your hands. I want you to wash your hands with warm water and soap for 20 seconds. A lot of people forget to wash the backs of their hands, their thumbs, and under their fingernails. I also want you to avoid touching your face because a lot of germs are spread from the hands to the mouth. I know this sounds really simple and maybe it's overstated, but I can't emphasize enough how much washing your hands can keep you safe. Secondly, I want to talk to you about vaccines. If you haven't had your flu shot this year, I recommend that you do so soon, or we can give it to you here before you leave. This is an annual shot, so you get it once a year in the fall. Typically, you want to get it before the end of October. You can also talk to your doctor about possibly getting the pneumococcal vaccine, which helps to prevent pneumonia and things like pneumonia. This is important for adults to consider getting after they turn 65. It's really important that you stay away from crowds if at all possible. When you are in close proximity to other people, this puts you at a bigger risk for getting infections. This is even more important in the fall and winter because of cold and flu season. You can also wear a mask if you have to be around larger groups. Again, when you're around other people, it's really important for you to wash your hands. Finally, I want to talk to you about sleeping, exercising, and eating. The goal is for you to get 8 hours of sleep per night, and I know this can be hard sometimes, but your body and your immune system will really benefit if you can make this a routine. When your body is well rested, you can more easily fight off infections. I know that you said that you went for walks every day before you were in the hospital. Exercising can help to build up your immune system and keeps you healthy overall. Finally, to build up your immune system, it's important for you to eat lots of fruits and vegetables. Avoid foods that are high in fat and high in sugar because these can weaken your immune system. You can also focus on eating lean meats, fish, and low fat dairy. Do you have any questions for me? Okay. And here are some resources for you that you can look over, and they just talk about a little bit more of the science behind some of the things that I've talked to you about today. All right,